My name is Taylor Siemens and I am a nurse practitioner. I specialize in aesthetic medicine and I am joined today by a very important patient who also happens to be my husband, John. John, welcome. I'm so excited to talk all about men who get Botox today.
Yeah. Thank you.
Really curious, just to start this off. So I was in the industry for almost 5 years before you said, okay, I'm ready for your treatment chair. Walk me through kind of what took you so long and also what made you decide to get treated.
Took you so long? Interesting question, because it's really just something that didn't really cross my mind. It wasn't that I was very specifically holding out or refusing or anything like that. I just didn't have it as part of my routine. And so, I saw all the effort that you were putting in, and having some conversations with some industry friends, just realized that, okay, it would be great if, I was putting in a little bit more effort for my skincare routine and thinking about anti-aging and stuff like that a little bit more prevalent. So that's really about it.
I hear that a lot. People ask, do you think there's a stigma for men in injectables? And I don't necessarily think there's a stigma. I think that men maybe just don't think about it very often. And that's a common story I hear from my patients. My male patients is like, oh yeah, my wife has been doing this for years. I just never thought it was for me, or I never thought about it. Would you agree with that?
Yeah, stigma maybe, but yeah, really just more like, it's not really something that I think about often. Even being in the industry and having a business in the industry, it was just, okay, wash my face, put on my moisturizer, take care of it, that's about it.
You've got a better skincare routine now.
let's do a little bit more. And so it just kind of evolved from there, more than there was a stigma of, ooh, I need to stay away from this. It's for women only. Like, I didn't really feel like there was that much of a stigma.
So we finally treated you. It took us a treatment or two to really get your dosage locked in. One of which being you have something called ptosis, which if you're interested in learning more about that, we will do a whole educational video on ptosis. But that poses some risks and potential adverse effects with Botox. So we were always very careful with your placement. But some things we learned with you is, unlike most people, you really like to keep a lot of movement between your brows. So that is something very specifically. He likes showing emotion between the brows. You like to keep a little more movement to the crow's feet, but you don't mind kind of being more frozen to the forehead. So walk us through kind of how you were able to communicate that with me and that process of us kind of having a dialogue about dosing you better.
Yeah, it really stemmed from understanding that there were muscles that I felt like I was struggling through using or activating or whatever, that were a little too frozen in just regular conversation or excitement or something along those lines. I felt a little too restricted, and we just talked through that. Where I was feeling restricted, how much, and that just kind of progressed and evolved as we kind of tested it out and sought a more even balance.
To walk you through kind of a normal treatment appointment with something like Botox is you come in, we do a really thorough conversation, evaluate medical history, your wants, your desires, things that you've seen that scared you, things you've seen that you loved, and we talk through certain products as well. So we keep saying Botox. There are a lot of products like Botox that are anti-wrinkle injections or neuromodulators. Some really common ones are things like Xeomin, Dysport, Jeuveau, and Daxi. So we build a plan customized to your desires and interest off of that. I always mark my patients so we understand your anatomy to customize the treatment plan, which is so important. And then we treat. So talk to us. The question everyone actually wants to know is, does it hurt?
It doesn't hurt. I had a little bit of hesitancy the very first time I was in your chair because it was needles and I just wasn't familiar and didn't really know what to expect, but needles are small and it's, very, very light. And so, no, it doesn't hurt.
I love that. So we've got your before and afters here now. So we're 2 weeks after treatment. It's fully kicked in. Most patients will see results starting about 2 to 3 days afterwards, with full results after 2 weeks. And it lasts generally 3 to 4 months based on the dosage that we choose together to do. So any final thoughts to share with men who are maybe on the fence about getting treated?
Nothing to worry about. Think about the prolonging, your skincare and your anti-aging routine, and this could be something that's for you. There's not a stigma around it, I don't think, and so if it's for you, it is. If it isn't, that's fine too.
Yeah, absolutely. We are totally, I say all the time, we're not anti-aging, we are pro-aging. Like we want to age, we just want to do it well and on our own terms. And if that includes Botox for you, then rock on. If you happen to live in the Dallas area and you are interested in having a consultation with me, my booking link is below. But other than that, if you like this content and are interested in seeing more content around aesthetic medicine, we would encourage you to like and subscribe to this channel. If you have specific things you want to learn from a clinical point of view, please comment that below. Other than that, we will catch you next time.